Good afternoon and welcome to the Center for Sports Medicine and Exercise Therapy in Belgrade. My name is Biljana Djuric and I am one of the sports medicine specialists in this center. Today we will discuss how can we fight obesity and prevent it in young people here in Serbia. There are two approaches. The one is the approach that you can follow at your home with your kids in the family surroundings, and the other one is the approach that can be organized here in the center like this one. When you get with your child in semi-annual or annual pediatric checkups and your pediatric says that your child is becoming a slight obese and that you need to activate a little bit with your girl or boy, what is that you can do? For instance, you can organize some place in your home. You can go through chasing, hide and seek, you can ride a bike with your child, you can go skating. Try to implement around 60 minutes of activities that will go through the entire body of your child and that are going to last at least 60 minutes per day. Try to organize it as a game, as a play, so that child is not aware that he or she is actually exercising, or it is like that they are playing with you, and try to set a good example for your kid. If you're a person that sits a lot in front of the laptop, in front of the TV, you're watching your phone, that is something that you will show as the example to your child. So try to be active, try to go outside, try to ride a bike, try to have outside activities, and that is going to be the best way to prevent and treat this obesity. Remember, 60 minutes per day, it's something that is recommended, and try to do that almost every day with your child. When we are diagnosing and treating obesity in the centers like this one, the first step is actually the diagnosis. It is important to know if the child is slightly obese, obese or extremely obese, and we can use different approaches to diagnose the level of obesity. The most basic one is to use the measurement of body weight with some scales and body height, and then we can calculate the body mass index coming from those two parameters. But for children, it is really important to know how to evaluate the values that we got. So for adults, we have ranges that are like characteristic for the decade of the life. But for children, those parameters are changing with each year of the life because the children are growing. Each of these parameters, body height, body weight or body mass index, must be observed in the percentiles for each age of the child. So here we have a chart with the body height and body weight for girls and boys. So we have the different ranges coming from 25th up to 75th percentile for each of the values. If the measured values, so body height and body weight, are in between 25th and 75th percentile, the child is in the physiological range. Once when the child gets outside from that 75%, it is important to start with some of the activities to reduce the body weight in the child. For more accurate analysis of the body composition, we can use some other approaches like measuring the body fat percentage in the children's body. One of the older ways, but also one that is actually accurate, is measuring the scale folds using the caliper method. So we will measure scale folds in different areas of the body, use the values that we get, put them into the formulas that are gender specific and age specific for children, and then calculate what is the percentage of body fat in them. But also we now have some devices that are more modern and that can be used in order to measure the body fats inside of the body and also the body muscles. Those are the bioimpedance models. So this is the device that actually can give us the information about the amount of water in the child's body, the amount of bones, minerals, body fats and body muscles, so we can follow the changes of the body composition throughout this therapeutic period in children. Once when we measure the body fat percentage for our little patient, we can see in which range they are actually. So here we have the chart that is representing the percentage of body fat in girls and in boys, and we want to have the children in this green area, so that is the healthy physiological range of body fats for the age coming from the age of 5 to age of 18. And once when we have the yellow and red areas, that is the obesity. Yellow, that is the slight obesity, red, that is actually obesity in children, so we need to start with some therapeutic measurements, starting from the dietary changes, but also the exercise that are organized in this center. Once when the obesity is diagnosed, we will start with the treatment. So the treatment comes from two approaches. One from nutritionists that will organize the dietary program for the child, and the other one is exercise. The best known recommendations and the one that are widely used in the world are the recommendations given by the American College of Sports Medicine that are including the organization of dynamic exercise, strength exercise, stretching exercise, and coordination and balance exercise. It is important to have at least 5 days per week in dynamic exercise, 2 days per week in strength exercise, and as many days as possible of the resting exercise programs. In order to organize the adequate dynamic exercise, we need to perform them at least 5 days per week. If we choose the moderate effort, you should organize exercise that are lasting between 30 and 60 minutes per day. If you will go through another, maybe bigger effort, like the more vigorous effort, those exercise programs should be between 20 and 60 minutes, but at least 3 times per week. And what are those activities that are efficient as dynamic exercise? Those are the activities where we activate the entire body. So that can be walking, of course outside, or if you are in the gym, you can use the treadmill. So for walking, for brisk walking, for jogging, don't go for the running. Just go to that effort jogging and try to perform that at least 30 minutes per day. You can do it like one session, or if it's too hard, you can go in smaller session of 10 minutes and then accumulate the time needed for this exercise program. If you are not a fan of walking, you can also use the bike. So here we have actually the exercise bike for the gym, but again you can use the bike for going to school, you can use bike for going to meet your friends, and try to organize your dynamic exercise through that activity. It's going to be something that is going to connect the children in between, but it's going to be also the great exercise for dynamic programs. In the end of those dynamic programs, you will also try to include some stretching exercises in order to help your muscle becoming more flexible. We must be aware that children are actually the growing organisms, so their anthropometry is changing almost on the monthly period. And that is why it's important to follow that growth and to find out if during that growing there is more muscle mass in comparison to the body fat mass. Of course, body fat is important. We need to have it because it's the part of our body that is necessary for the synthesis of different hormones like sex hormones, steroid hormones, etc. It's a part of almost every single membrane in the cells in our body. But during the growth of the children, we like to have those more muscles and less fats in their system. Because of that, it's important to include some of the resisting trainings or the strength trainings during the therapy of obesity in children. The recommendations of American College of Sports Medicine are that at least 2 days per week we need to organize such of training. It's important that during those trainings we activate some major muscle groups and that we have some exercises that are designed for younger children that are actually using tools that are like toys, like this one here or this one here. So the children will have the feeling that they are playing, but actually they are performing some exercises that are adjusted to their age. It's important that these trainings are followed by the licensed trainers that are actually working with children, so they can actually organize that type of exercise that looks like playing. In the older children and adolescents, we can also use some of the tools for those resistant trainings, like the rope or the kettlebell. So those are the devices that can be used in these trainings. It's important then in between each of those trainings, children and adolescents make the pause that is around 48 hours and then start with the new group of the muscles. 2 times per week or 3 is something that is recommended, and always activate the major muscle group. It is important that dynamic exercise and the resistance training are followed by the flexibility exercise, coordination and balance exercise. Those flexibility exercises are mostly organized as a stretching of the major muscle masses, and we can always perform them after dynamic exercises, because in that case those muscles are warmed up and the stretching is going to be easier and better for the child. On the other hand, it's important to follow the recommendations for the coordination and balance and to include those activities as frequently as possible throughout the week. For those kind of activities, we can use the Pilates balls. We can also implement them in the children everyday living by using those balls instead of the chair. There are different types of those Pilates balls, but also the balance can be exercised using different balancers, so ones that are for smaller children and going for the elder one. It's important to include these exercises, if it's possible, even daily, but if it's not, at least 5 times per week.